Follow Dr. Sanjeev newer info for absolute control on uncontrollable hypertension. Probably all previous guidelines like to take appropriate treatment and to reduce salt in diet, also to reduce weight and obesity, are all previous guidelines. Other than these newer info patients can follow to control blood pressure. Number 1. Kefir, a fermented milk drink, is known for its probiotic properties that help to rebalance gut bacteria and further control blood pressure. Secondly, mulberry extract activates brown fat, shows promise for obesity and hypertension. Mulberry, called rutin, can activate B8 in our bodies to increase metabolism and facilitate weight loss, thus control blood pressure. Third point, multiple studies have found that pomegranate juice can reduce both systolic and diastolic blood pressure. For example, one study found that drinking 50 ml of pomegranate juice daily for 2 weeks lowered systolic blood pressure by 5%. Pomegranate juice is rich in polyphenols and antioxidants. However, if you already take medication to lower blood pressure, pomegranate juice could increase the risk of having low blood pressure. Fourth, more recent studies linked the Mediterranean diet with lower risk factors for heart disease, such as high cholesterol and high blood pressure. Today, the Mediterranean diet is one of the healthy eating plans that American nutrition experts recommend. It's also recognized by the World Health Organization as a healthy eating pattern. Fifth point, coconut sugar may lower blood pressure, artery stiffness in older adults. A first-of-its-kind study finds a natural coconut sugar may help reduce the risk of cardiovascular disease by improving blood vessel health and managing high blood pressure. Higher blood pressure and arterial stiffness with older age are two risk factors contributing to cardiovascular disease. In a new study, researchers explored the effect of a natural sweetener on blood pressure and arterial stiffness in middle-aged and older adults. Coconut sap powder, which is a natural sweetener derived from coconut sugar traditionally used in Asian cuisine, is rich in vitamins B and C, as well as iron, calcium, and potassium. Coconut sap powder also contains flavonoids and nitrates, compounds known to contribute to blood vessel health, and inulin, a prebiotic soluble fiber that helps regulate blood sugar levels. Previous research suggests coconut sap powder increases antioxidant biomarkers in young adults. In the current study, a group of volunteers with an average age of 55 took either a coconut sap powder supplement or a placebo every day for 8 weeks. Before and after the trial, the research team measured the volunteers' resting heart rate, cholesterol levels, markers of inflammation, blood pressure, and arterial stiffness. For further information or treatment, please contact Dr. Sanjeev Stem Cell Science on WhatsApp 9323275869.